Well, hello, Ivana. Thank you
Hi.
for attending tonight. Um, Talk about why healthcare providers should educate patients about their health and their benefits. And Ivana, I just want you to introduce yourself and give us a little bit about your background and go from there.
Hi, my name is Ivanna, and I currently live in Wichita, Kansas. I have a bachelor's degree in psychology and mental health. I was born and raised in Puerto Rico, so I'm fluent in Spanish. I worked in the military for 4.5 years. I was a human resource specialist, and I currently am back at the civilian work working for the county where I live at in the mental health um, institution that they have.
Okay, okay, okay. So, and also thank you for your service. So let's begin.
Yeah.
Um, I read an article. It was a article about, it's why, healthcare providers should educate patients about their health and their benefits. And so let me just share the story what really caught my attention. There was a young lady, let's call her Maya. She lived in Minneapolis and she was a devoted wife, loving mother of two young boys. However, Maya carried a burden that weighed heavily on her shoulder. And so Maya, had always been told that health was wealth. And we know that as
Mhm.
healthcare providers. And she truly understands the value of this, saying, of this, saying until one day, um, when she woke up one morning, she was rushed to the hospital. And so what happened was, she kept feeling like chest pains. I mean, uh, she was she was feeling dizzy and things like that. And so within minutes, she had passed out. And so her husband um, had called 911 and the ambulance, arrived within minutes to rush her to the hospital. So the doctors had diagnosed her with a heart condition that required immediate surgery. So as Maya was laying there, on the operating table, and she couldn't even, according to what she said in the interview, she said she couldn't even shake the feeling of a fear and uncertainty. And she was wondering about the cost of the surgery, her family, and what could happen if she couldn't even afford the medical bills. So after, the surgery, Maya was relieved. She was relieved, I'm sorry, to just be alive. But her worries
Yeah.
was, were far from over. And so as she recovered, in the hospital, a kind-hearted nurse. I know when I read this story, her name was Sarah. She noticed that she had anxiety, and she would just appear to be so stressed out. And so Sarah sat down beside her, and well, she actually sat down with her and gently began to explain the importance of health and insurance. And so, Maya, she listened and, things like that. And I like what she said in the story from what I recall. She said, you see, Maya, healthcare is not just about treating illnesses, but it's about empowering patients to take control of their well-being and knowing that your health conditions and your treatment options are available and your insurance coverage can make all the difference in the world. And so Maya listened, and it was a valuable information about managing, her heart condition, her necessary medications, and things like that. And so, you know, I want to say with your experience and your coming in contact with patients and sharing, because I know that you told me that you also you're an educator. You educate patients about the importance of their health, their benefits. And so why do you think it's important for individuals to be educated about their healthcare benefits?
So when individuals are informed of their benefits, they know how to use them appropriately and without fear. Um, we can see that the United States is the one of, well, if not one, the most expensive, has the most expensive healthcare system out of the wealthiest countries in the world, correct? Per average, the expenses per average per individual runs around almost $15,000 in medical expenses, and more than half of the population has a minimal medical debt of $1,000
Oh wow.
because yeah, because they don't know, um, they're not very educated on the insurance that they have, the benefits that the insurance has, the a lot of like one of the simplest example, if we're talking about this story, I want to know, did she had any concerns prior? Was she feeling sick prior, and did she refuse to go to the doctor because she just brushed it off? She was like, "No, it's okay. I don't need to go to the doctor," which happens a lot. A lot of
Yeah. Yeah.
individuals be like, "Oh, I don't. It's just a little bit of a pain. I don't want to pay the $20 copay for them to tell me it's nothing," and they forget that healthcare, like, we don't only have to tackle when it's an emergency, we can take care of our health to avoid getting to that emergency that is not only gonna be worse for the individual because your health at that point is in such a predicament, but also because the expenses are gonna be more. And one of the things that I like to tell patients is that the examples of ER, urgent care, and just like going to your clinic, right? I have a
Uh-huh.
headache, I can call in, have an appointment, get medication, and that's $20 copay. I refused to go and do that $20 copay because I didn't have the time. I didn't want to do the hassle. Now I have a migraine, it's getting worse. I'm gonna go to urgent care. It's a $50 copay
Right.
on top of medications, right? I I decided to not go to urgent care. I decided to brush it off, and it's 3 in the morning. Urgent care is not open. My clinic is not open, and I cannot even think. I'm throwing up because the headache is so bad. I can't do anything. I'm calling an ambulance. Ambulance is another cost. A lot of insurance don't cover ambulance transportation,
Right.
right? That's another cost. I make it to the hospital, and it's now a minimum copay for emergency just to see me of $500, and then the cost of whatever else happened. And my network is another network. Is the doctor that saw me in network? All of those things. And when it's an emergency, you're not thinking about it.
Right.
You're not
Right.
thinking about it. So that's why it's so important for individuals to be aware of what they're signing up for when they're taking healthcare, like any healthcare benefits.
Right. Okay. So my second question is, what impact does educating the community about healthcare benefits have on the individual and society as a whole?
Yeah. I saw this. I'm gonna do a little bit of a quote that says, poor health status is associated with higher rates of medical death, even among individuals that have higher incomes. So we're talking about everybody.
Right.
If they don't take care of your health, the whole community is gonna be affected. And when your whole community is affected, the economy is also affected. We saw that in COVID, how the economy
Yeah.
plummeted because the whole community was sick, or a lot of people got sick, and we had to take preventative measures of not doing this and not doing that. And what happened to the economy, right? Because
Right.
it was such a risky thing to do, right? So if we already know that poor health equals bad economy, individuals that postpone their appointments equal poor health, we see like a pattern, right?
Uh-huh.
We we are seeing that the community is sicker the community, the safer is. It's like I said, I'm sorry that I'm being a colleague again, but what was the big thing? Stop the spread, right? Stop the spread for the community to be able to function. We needed to stop the spread. We needed to cover ourselves. We needed to work in community for me to not get the other person sick and all of that. That's how important is the same with health benefits. Another thing is like when individuals are not taking care of themselves because they don't know what healthcare benefits have in the community, you're putting higher pressure in the hospitals in your community, in the doctors in your community, meaning that the wait times for services are gonna be higher too.
Right. Right.
And a lot of people don't understand that all of that links together and be like, oh, I have to go to the hospital and I waited 4 hours. I wonder why.
Right.
It's what's going on in the community. Are people not taking care of themselves? Are people just waiting to the last minute to go to the ER or the urgent care? These are things that a lot of people don't think about of the how to take advantage of the healthcare benefits, mostly because they don't know that they even have that they even have like a lot of healthcare insurances have like a if you go once a year for a general checkup, once a year, a general checkup that is gonna take you like maybe less than an hour of your day. They
Right.
either give you $100 back, they give you like they give you points, they lower your premium just because you're doing that. Even
Right.
dental insurance, if you do not go to your one or your two, depends on the health on the dental insurance. If you don't go to your yearly checkup, then your copays are gonna be higher because you're not taking care of your teeth.
Right. Right.
That's on you. It's a lot of preventative measures, and a lot of individuals don't even know that that's our rules or that that is something that is there, and it affects the whole society.
Yes. Yes. So okay, in your professional opinion,
Yeah.
what are the most significant barriers to educating the community about healthcare benefits and how can they be overcome from your professional opinion?
I see it a lot. Um, it's it's very overwhelming, right? When you're
Mm-hmm.
giving out this information, it can be very overwhelming. And I think everybody has that mark on their adulthood life where they got their very first big job, like your very first adult job, and they give you all these benefits, right? And you're like, huh? What is this? And you kind of sign on and read on and put them in the back of your head and don't even think about it anymore, right?
Right.
I think that's one of the biggest barriers is that we are having this, we are it's out there, right? And
Mm-hmm.
people are signing up for healthcare benefits. People are looking for healthcare benefits, but they're not understanding the healthcare benefits because the information is either not simple, where like healthcare insurance or pretty much just anything likes to use big words that day to day other people don't use.
Mm-hmm.
If I go to somebody in the street and I ask them, "Is your health insurance a PPO and HMO?" They're gonna look at me like, "What are you talking about?" Because they
Mm-hmm.
don't see this every day. So
Right.
that's a big barrier. We're using words that they cannot relate. They don't see every day. They
Mm-hmm.
don't pay attention to that.
Mm-hmm.
We also need to understand that we're giving a lot of times we're only giving that information once, like when they sign up for benefits, right? We only give them that time. And these individuals are mostly preoccupied, overwhelmed, and stressed for other things in their lives. So
Right.
they, while we give it one time, they're not really thinking about it. Most of the times, they're not really thinking about it. So um, there has to be a continuous education of the healthcare benefits. And I'm talking about like a monthly checkup or a monthly email, like, hey, these are your benefits. Remember, you can do this, and this. You can send it in an email,
Mm-hmm.
text message. There's an app for the many big healthcare organizations have apps, right? In
Right.
hospitals too, where then you can check in and stuff. I feel like, hey, remember, you can do this. Remember, if you're older than this or at this age, you can come in and get checked for this and the other. You need to start scheduling your appointments. We see that for children. We see that their pediatrics, they give you this big magnet that tells you when they have to get vaccinated and the time frames that they need to get vaccinated and the this that they need.
Right.
Why are we not doing the same for the generalized population? Why are we not pushing those checkups? Hey, if you're 30, you need to start thinking about checking your heart, your kidney, and a regular blood general CBC. Like let's check what your levels are. Why are we not doing that? Why are we
Right.
making it so difficult for individuals to seek and know that this is something that they need to do to keep their health in balance? Most insurance have all those checks. Most insurance be like, oh, you're a woman, you're 35, you have a history of cancer in your family. It's time for you to do this checkup and this other checkup and this other checkup. People don't know.
Right.
They don't know. So a simple email once a month. Hey, remember, these are your benefits and you can use them at any time. And if you have children in these benefits, these are the benefits that they have. In simple words, very basic, maybe that can help a lot in that barrier that we're having to overcome those lack of communication.
Right. So, you know, I agree with you. So here's another question.
Yeah.
How can healthcare providers and organizations ensure that their patients are well informed about their healthcare benefits?
Well, that's a tricky one because they were doing healthcare providers. They deal with a lot of different companies and insurances that their their benefits are a little bit different, right? So that
Mm-hmm.
can be a little bit tricky. But again, um, we have like a generalized information of what each, like the difference of in the Medicaid and the Medicare, the difference of all of that, right? We have like a little bit of a generalized kind of like idea of what we can do. So when we're seeing providers are seeing patients or clients, they can start like educating them and be like, hey, how old are you? Have you
Mm-hmm.
checked on this? Have you checked on um have you checked on your heart? Have you checked if you remember your insurance more than likely will cover it? Like having those reminders when you're seeing the patients of like your insurance will cover it, or we might just need to put a referral for this, but we can work with your insurance to work on this referral for this because normally the benefit is in there. Um, so the patients know and they just don't go through because we see different patients, right? We see different patients with different insurances, different benefits. So we have an idea of what each insurance has for benefits of what we can offer them to. So
Mm-hmm.
we can just put the ball out there, put the thought out there in their mind. Um, it's
Right.
also very important to make this information accessible for languages, different languages, different cultures. That is a very big barrier that we see a lot. It's something that my organization is working a lot. We do the surveys every year of the most spoken language in the area. So we know that what are we needing? We need English, Spanish, and at this time we need Vietnamese. There's a huge population of Vietnamese where I work at. So these are three languages that we need everything that we're handing out to like to offer benefits of what our services are in those languages. And that is also very important when we're giving that education. Hey, do you need this education? Is it easier for you to understand this in another language, in your language? What is your language? Can I print this out for you? And it's also important for the companies and the insurance to provide that too, to have that ready for us to be able to give it out for the patient.
Right. Okay. And our last question.
Yes.
What role do you think technology can play in educating the community about healthcare benefits?
Yes. Earlier I mentioned email.
Mm-hmm.
That's technology right there. We have apps. We have all of these magical things that we can use to communicate, to educate patients. Um, we have insurance companies that already have their apps, and once you have your benefits, you log in and they can tell you your reminders. You can see your referrals, you can see all of that, and they have glossaries in there
Right.
that help you understand. That is like one of the biggest things that I like that I'm seeing a lot is when the health insurance or the providers have like a hyperlink link that you can like, what is this? What does this mean? Because they know it's not a
Mm-hmm.
normal or a common thing that anybody else is seeing, that you can click and it gives you like a brief summary, so the person doesn't have to
Got
like,
it.
okay, let me write that down and go back to Google that, and
Right.
don't even make it that complicated. Click here and it's gonna tell you what that is, you know?
Yes.
Um, so those are big advantages that you can have in technology, in those little apps, in those little emails, in an easy accessible web page that they can find. It gives the education right there in their hands. And it also helps the insurance because they know what is expected too of them for them to use their benefits. It's like that is also educating them, like telling them what is expected of them, what the payments or what is needed for them to do in order to get like a referral or whatever. Um, it's you're giving them also a little bit of power, and
Mm-hmm.
normally it helps out for them to be like, I'm in control of my health.
Yes. Yes. Because from I've been in healthcare, 27 years, and I've
Mhm,
seen a lot of changes. And now that I am a cloud engineer, and
mhm.
technology can be to streamline the process of understanding benefits for patients by providing, like easy access to information through apps. I've seen through online portals. And
Mhm.
also, what one thing I love about it, it can offer like personalized recommendations,
Yes.
track benefits, the usage, and even provide real-time assistance through chat box, and ensuring patients, to
Mhm.
maximize, their benefits and make it more
Yeah.
informed, healthcare choices. So,
Yeah.
you know, here, to close out, our talk, healthcare providers, should educate patients about their
Yeah.
health and also the insurance, because knowledge empowers patients
Mhm.
to make informed, decisions. Also, it promotes better health outcomes And I want to say it also ensures that they can navigate, you know, through the healthcare system with confidence and ease.
Yeah.
Yes,
The
yeah.
healthcare system is it's complicated. I give them
Hmm.
that. The healthcare system is very complicated, and if you don't see a lot of things on the daily, it can be very overwhelming. But
Yeah.
once you, but it's something that we all need to be familiarized,
Yes.
and
Yes.
because it's your health, it's your child's health, it's your mom's health. It's something that you need to be familiarized with,
Hmm.
with everything. And now we have the technology. Now a lot of organizations, like you say, like it's coming, it's out there. We just need to explore it more.
Hmm.
Like a lot of when you go to see your doctor, a lot of doctors be like, "Hey, if you want to see your results, here, scan this," and you have like QR codes, scan this, create
Yeah. Yeah.
your account, and you can see everything in there. Hey,
Right.
yeah, yeah, give them that control, give them that power
Yeah.
for them to be like, oh yeah, you know what? I am in control of my health. I am gonna do this
Right.
because I wanna know what's going on. I wanna know when my next appointment is. I wanna know how I need to book my next appointment. I wanna know my something that you mentioned, like it tells you how much you're spending and how much you have left on your premium or your deductibles and all of that. And I have seen people that spend like use all the deductibles because they have family and a lot of things and they plan out surgeries to that. Like
Yeah.
I already know I'm gonna spend it, so I'm gonna have my surgery the last, so I don't have
Yes.
to pay as much. But hey, that's how it works because you know your
Yes.
insurance, you did your homework, you know your benefits, and I am proud of you for doing that.
Right. Right.
Yeah,
Right. Okay. Well, I'll thank you so much for attending tonight's talk. And this was a awesome chat that we had tonight. And so, do you have any comments or questions before we end?
I am so sorry.